What is up, everybody? I hope you're having a wonderful day. Welcome back to the Relentless Pursuit podcast. Today, we're going to be talking about how you can lift heavy without back pain. Yes, you can have both. So, pretty much what we are going to be going over today is talking about how to prevent, overall injury, but back issues are usually pretty common. So, prevent overall injury while, training hard, training. So, let's get into it. All right, you guys, just a quick little note. There is a dog in my apartment complex barking. So, if you hear it in the background and it annoys you, I apologize. It's annoying me too, but I wanted to get this podcast recorded. So, hopefully, you can't hear it. Anywho, many lifters that I know have back pain, including myself, because I hadn't learned what I know now in my past decade of lifting. I've been an athlete for 16 years. I've been training for a very long time. And sadly, these things that I'm going to be going over today are not taught, nor were they necessarily really known back then. But that is why I am teaching these to you today. You are going to have an overview of a few principles that you must follow in order to lift heavy without back pain, because they do not need to coincide together. Okay. So let's get right into it. The first one is honestly really simple. It is load management. So, what does this mean? So, load management is pretty much not lifting too heavy or not putting too much stress on your body. Let me explain this a little bit further. So, let's say if you are rehabbing from an injury, because this is honestly the best way to explain it. You're rehabbing from an injury, let's say you tore your hamstring, okay? So when you are rehabbing from injury, obviously you need to have this initial, probably like you take time off of lifting, any exercise phase, while obviously you probably get it repaired depending on how bad the rip was. We're not talking about that. We're talking about when you get back into lifting. You're not going to just like get under a ton of weight initially, right? What you need to do is start at the absolute basics with the lightest weight that your body can handle without any pain. So, from there, you started with super, super lightweight. Maybe you've just started with body weight. I don't know, whatever you can handle. Then you want to slowly increase the weight while managing or while keeping an eye on your symptoms. So if you notice, this hurts a little bit when I'm doing this exercise, I'm going to go down in weight. Or maybe the day after, my hamstring hurts a little bit too much. Maybe I shouldn't go that heavy yet. So you drop the weight for the next week. And then maybe the next week you test it a little bit higher. This is what I mean by load management. Now, this is not just applicable in a rehab setting, okay? Obviously, I'm not a physical therapist, so that's not what I do. What I do and how I help my clients implement load management is pretty much just helping them implement proper, which is the next one, progressive overload, okay? So, with load management and implementing proper progressive overload, which I'm going to get into the specifics of that, but pretty much it's just not increasing the weight too heavy. If you're trying a new exercise for your body, not, maxing out, managing the load and then increasing incrementally as your body can manage. Now, the reason that load management is really important is because 99.99% of times when I see individuals hurting themselves in the gym, injuring themselves, whatever, it is because of improper load management or improper progressive overload, right? They're going heavy too quickly. They're progressing too quickly. Therefore, they're putting too much stress on their body and their body just can't keep up, whether that be their muscles, whether that be their tendons, their ligaments, maybe just their joints in general. If they're not able to keep up, therefore, it causes this overuse injury because the stresses that you're putting on your body is harming your body a little bit too much. And then eventually, if that keeps going and you don't recover your body properly, that'll lead to injury. So, that is the first 1.5 points of making sure that you are implementing proper load management. Now, the next one is implementing proper progressive overload. There are a few ways that you can implement proper progressive overload, and we're going to go over them today just for a brief overview. So pretty much just to give you a brief overview, progressive overload is a principle where you continually increase the demands on your body to continually gain muscle size, strength, and endurance. So to properly implement progressive overload, you can implement it in a few different ways. You can either implement it with weights, reps, sets, duration, decreased rest, or you can progress to more difficult exercises, which are things that I implement for every single one of my clients' programming. So for implementing progressive overload, pretty much what you want to do is increase every 1 to 4+ weeks, depending on the individual, to reduce the risk of injury, burnout, excessive fatigue, the dreaded plateau, or insufficient recovery. So why you want to increase every 1 to 4 weeks and why that range is honestly pretty large is it really depends on how long you've been training for, right? More seasoned lifters will progress a lot slower than new lifters because obviously if you're like getting pretty close to your genetic potential, then obviously you're going to be progressing a little bit slower. That's just how it works. But in the beginning, you can probably increase weight like every week, which is honestly like the super fun part about being new in the gym. It's fun. But you don't want to increase it too much because again, that can lead to injury, fatigue, you know, hitting a plateau earlier than you should because your body isn't able to keep up with the demands that you're putting on it because of insufficient recovery, right? So the goal with progressive overload is to be working around RPE, which is rate of perceived exertion, 7 to 8, 80% of the time, and 9 to 10, 20% of the time. So with this, you should definitely be increasing your weights appropriately and still putting the proper amount of stress, you could say, on your body without overdoing it. Like some people will say, lift to failure every single set, every single, rep or whatever. Sorry, every single set, every single day. I said that weird. But I do not agree with that. And the reason is it is good to push your body more. Okay. However, if you are actually pushing yourself to failure every single set, that's just too much stress on your body. But RBE 7 to 8 is still really high and a lot more intense than you'd think, which is why it's sufficient for still getting enough out of your workouts while still not pushing too much to where you risk injuring yourself. So I'm going to explain real quick how to actually implement progressive overload so you can understand this a little bit better. So for an example, let's say you're doing squats 3 by 8 to 12 reps with 2 reps in reserve. So reps in reserve would probably be equivalent to about RPE 7 or 8, okay? So what you want to do is begin by determining the weight that you can lift for 10 reps without failing. Then start your workout with that weight, but aim for only 8 reps. So that's 2 reps in reserve, right? Leaving 2 in reserve. Over time, what will happen, you'll become stronger, you'll be able to lift that weight for more reps. And then once you've completed all 3 sets for 12 reps, what you want to do is increase the weight and start again from step 1, going right back to, all right, this weight I can do for 10, but I'm going to do it for 8, and then the next week 10, the next week 12, until you're able to do that consistently in the appropriate RPE. And again, you can change around what RPE you are working in or RER, these, coincide together to, work in RPE 7 to 8, 80% of the time, and 9 to 10, 20% of the time. This is a little bit of a complex subject. So if anything I'm making doesn't make sense or you need help, clarification, let me know, because this is definitely something that you want to get down. All right, so the next one here is implementing proper periodization. So a lot of people have actually not heard of periodization. This is one thing that I teach all of my clients to so that they're able to independently periodize their training and nutrition. So, eventually when they're done working with me, they're able to do it on their own and have the confidence of knowing how to do it. So to periodize your training, first thing, let's talk about training phases. This is one thing that many of my clients are a little bit confused on when they first start working with me. They're like, why are we going through these different phases? What are they for? So I'm going to explain that today. With your training, you want to divide your training program into specific phases based on your individual goals. So common phases can include the foundational phase, maybe if you're getting started and you're wanting to go back to the foundations, a hypertrophy phase, which is aimed for muscle growth, a strength phase, which is focused on increasing muscle strength, and a peaking phase, which is fine-tuning performance for specific events. There are other phases you can do, like a metabolic phase, which focuses on metabolic health, more like in muscle endurance and stuff like that, depending on your specific goal. But picking which phases that you specifically need and then integrating that into your program for a progressive plan to achieve your goal. You can mix phases, such as if you don't want to just be working on hypertrophy, you can mix hypertrophy and strength, whatever you prefer. But I usually like having specific phases at specific times. And of course, I adjust what is in the phases depending on the individual. And I adjust when they're doing phases depending on what their goal is or which phases they're doing, okay? The next one is determine training variables. So manipulate training variables such as volume, which is set and repetition, intensity, which is the weight used, frequency, which is the number of training sessions per week, and rest periods. So what you want to do is adjust these variables according to each of the phases objectives. So obviously it is really important to have a set phase of, okay, this is the phase that we are in, so that you're able to determine the variable that you're going to use in that specific phase depending on the outcome that you want from that phase. The next one is to plan training cycles. Create a schedule that outlines the duration of each training phase and the transitions between them, and gradually progress from one phase to the next to ensure adaptation and minimize the risk of overtraining. This will help you not to stay in a hypertrophy phase for like 6 months and then be like, oh, shoot, I need to like maybe do a little bit of strength training, right? So you're constantly getting the benefits from the different phases while progressing properly, okay? The next one, which is really important and you really need to pay attention to, is implementing DeLos. DeLos are so important when it comes to periodizing your training. This is something that I missed out when I was lifting in my beginning of my lifting career. I knew about DeLos. I knew that they were important, but I didn't think they were important. I didn't think they were that important. So I didn't implement them nearly enough. I implemented them maybe like 1 or 2 times a year, which is not enough. So what you want to do to implement deloads is schedule a deload every 4 to 8 weeks. Now, some people like to actually have a deload every 4 weeks and have it set every 4 weeks. However, with my clients, I give them the choice of making sure that they implement a deload every 4 to 8 weeks, especially my more powerlifting clients, so that they're able to manage their loads, intensities, and ensure that they're allowing their body to fully recover. But some people, they just don't like, because of their training intensity or the type of training that they're doing, they don't need to deload every 4 weeks. It's just too frequent, especially since if they're not putting too much stress on their body and their body is recovering perfectly fine. For those individuals, especially if they're not specific powerlifters or athletes, they don't need a deload every 4 weeks, but at least every 8 weeks, some sort of deload where you lower your intensity is really recommended. So to know if you need a deload, if you haven't had a deload in a while, what you want to look out for is if you notice a decrease in performance and overall health, maybe your sleep is worsening, maybe you're not, well, I guess you're not recovering properly, like your muscles are like sore like 3 days after. There's a lot of determinants of that you need a deload. If you're just not feeling good at all, a deload can actually be a really refreshing way to just take a step back, let your body recover, and then go at the next week higher. So on a deload, typically, what you would do is just lower your intensity and volume to RPE 5 to 6. So you're still getting a pretty good workout in, you're just lowering the intensity. However, if you feel like your body needs more of a deload, you can literally change the whole modality of training that you're doing to maybe just doing like incline walking, or maybe you can try like yoga or Pilates or something like more lower intensity if you feel like your body just really needs a break. And then the next thing that's really important when it comes to periodizing your training, as I talked about in the how to implement progressive overload, is training at the right intensities. So just to remind you, working around RPE 7 to 8, 80% of the time, and RPE 9 to 10, 20% of the time. That's a good recommendation to be training at the right intensities consistently. So that is how to periodize your training. I know that's definitely a lot and it can be a little bit confusing to actually know how to work into your schedule. So again, if you need any help getting some expert individualized programming, definitely let me know. I would love to help you out. But moving forward to the last 4 that we have here, actually, no, the last 5 that we have here, I have a lot for you. These are a little bit more simple. So the next one is pretty much just never work through pain. This is one thing also that I missed when, my early lifting career. If I had pain, I would just work through it. Being that I grew up in martial arts, because I grew up around the no pain, no gain mentality, right? And of course, you need like your muscles are gonna hurt, when you're working out, but it shouldn't be a bad hurt. There is a difference between pain from, oh, I'm doing like 20 bicep curls, my biceps hurt, to like, oh, I think my biceps are gonna rip, or like my elbow joint hurts really bad. You need to understand the difference between good and bad pain because you never want to work through bad pain. If you have any bad pain at all, I always recommend change the exercise, lower the weight, or just stop immediately, depending on what the pain is, because it is not a good idea to work through pain. And I would give it a few days if it's not too bad pain. I would give it a few days, maybe a week, see if it heals on its own. But if it doesn't heal or if the pain isn't going away at all, definitely see a physical therapist. I always recommend doing that just because you want to make sure that you don't cause any more issues, because a lot of times a certain injury can just be there and kind of nag you, but then you keep working through it and then it just gets worse and worse and worse. And then eventually it is a terrible injury that you need to, maybe get surgery for, or take like a year to recover from. And obviously you don't want that. So never work through pain, okay? Bad pain. The next one is lift with the right form for your biomechanics. I actually recorded 3 podcasts on the ultimate squat, bench, and deadlift checklist to learn how to squat, bench, and deadlift for your biomechanics. So if you want to learn how to lift with the right form for your biomechanics, I'm not going to explain that in this podcast because I don't want this to be too long, but I would highly recommend going back and listening to those podcast episodes. They're pretty short and information packed. And every single person who had listened to this podcast have absolutely loved them, said they were super helpful. They always learned something, no matter how experienced they were in lifting, powerlifting, whatever. Because yeah, I touch on a lot of different points of the technique. So highly recommend going back to that, but definitely lifting with the right form for your own biomechanics is extremely important. The next one is don't sacrifice form for heavier weight, or in other words, don't ego lift, okay? There's conflicting stuff on the internet to what ego lift means. Some people say ego lifting is just like lifting to failure, or, lifting heavy, whatever. No, ego lifting is sacrificing your form just to lift heavier weight. You are not impressing anyone. If your form is crappy, no one is impressed by in what you're lifting. And by crappy, I mean like a 4th squat, or your back is completely just bent when you're trying to deadlift. That's what I mean by sacrificing form, okay? Sometimes your form kind of like goes a little bit when you're maybe maxing out or something like that. Your low back maybe rounds a little bit. That's not what I'm talking about. I'm talking about your form getting just terrible when you're trying to lift heavier weight, just to maybe look good or feel good, feel like you're boosting your ego or something like that. Don't do that. Seriously, it's the stupidest thing you could do. Next one is to train the little muscles. I know this one is a little bit of a boring one, and a lot of people don't like doing this. And training the little muscles really depends on the individual. So pretty much like what your problem areas are. Typical ones that I typically recommend individuals do is training their hip flexors, anterior tibialis, making sure that they have strong ankles, because the ankles are really, really important for your, the rest of your body. Even if you're just walking around, you want to really have strong ankles. Glutes aren't really a small muscle, but make sure you're training those glutes. Those are also really important. Rear delts is also one that many people neglect. Rear delts are super important to train, as well as like making sure you're warming up your rotator cuffs. Different things like that is what I mean by training your little muscles, making sure that you have good stability, maybe doing like single leg RDL, single leg touchdowns. Just like sprinkling them into your programming is always a good idea, just to make sure that you maintain proper functionality so that you're able to stay strong and healthy, okay? Alrighty. The final one that I have for you here is to go back to the foundations for a phase every 6 to 12 months. Now, what I mean by this is you shouldn't be, depending on the individual, depending on your health status, depending on your age, whatever, you shouldn't be, just lifting super heavy every single month of the year, okay? I typically recommend having at least 1 month. A phase is 4 weeks, right? I recommend having at least 1 month where you just go back to the foundations, or so pretty much just quit barbell work, maybe go back to functional work, fix any issues that you might have. Maybe you have a nagging shoulder injury, really just focusing on that. But going back to the foundations every 6 to 12 months is what I recommend for many individuals to just help them maintain their health, their hormones, as well as prevent injury. So these are a few of the principles that I continually implement into my coaching. And if you want to learn how you can lift heavy without pain, let's hop on a strategy call. DM me Train Smart on my Instagram at Rachel Sminis LLC with 2 A's, and I'll send you a link to book a free call today. There's also links down below that you can book a strategy call with me so that we're able to learn about your goals, what you need to do to achieve them, and how I can help you achieve your goals, seeing if we're the right fit to work together. So I hope to talk to you soon. I hope you got a lot out of this podcast. If you have any questions at all, please let me know.